In the autumn of 1918, Dr. William Henry Welch, a prominent American physician, stood at the forefront of the medical response to the influenza outbreak as the virus ravaged the city of Philadelphia, claiming over 20,000 lives in a matter of weeks. The streets were filled with the sound of coughing and the smell of disinfectant as hospitals overflowed with the sick and the dying. On October 1st, 1918, Welch received a telegram from the mayor of Philadelphia requesting his assistance in combating the outbreak, which had already spread to every corner of the city, with over 200,000 cases reported. As Welch rushed to the mayor's office, he was met with a scene of chaos and desperation, with doctors and nurses working around the clock to tend to the sick, and the sound of sirens filling the air. The city's hospitals were overwhelmed, with patients lying on cots in the hallways and on the floors, as the medical staff struggled to keep up with the demand, with some hospitals reporting a mortality rate of over 30%. Welch knew that the situation was dire, and that drastic measures were needed to contain the outbreak, which had already spread to other cities, including New York and Chicago. He immediately began working with the city's health officials to implement emergency measures, including the closure of schools, theaters, and other public gathering places, as well as the establishment of makeshift hospitals and quarantine stations. As Welch worked tirelessly to coordinate the response, he received a visit from President Woodrow Wilson, who was deeply concerned about the impact of the outbreak on the war effort, with over 100,000 soldiers infected, and the potential for widespread panic and social unrest. But to understand how we got here, we need to go back to the beginning of the outbreak, which started in the spring of 1918, in the midst of World War I, when the first cases of the virus were reported in the trenches of the Western Front. The virus spread rapidly, carried by soldiers and civilians alike, as they moved from one place to another, often in crowded and unsanitary conditions. By the summer of 1918, the outbreak had spread to every continent, with cases reported in cities from Madrid to Mumbai and from New York to Nairobi. As the virus spread, it left a trail of death and destruction in its wake, with entire families and communities devastated by the loss of loved ones, and the economy and social fabric of society severely disrupted. In the United States alone, the outbreak would ultimately claim the lives of over 675,000 people, with the majority of deaths occurring in the autumn of 1918, during the peak of the outbreak. The virus was particularly virulent, with a mortality rate of around 2.5%, compared to the typical flu mortality rate of around 0.1%, according to Dr. Welch and other medical experts. The symptoms were severe, with patients experiencing high fevers, pneumonia, and respiratory failure, as well as secondary infections such as bronchitis and sinusitis. The virus also seemed to target young, healthy adults, rather than the elderly and infirm, who were typically most susceptible to flu outbreaks. As the outbreak spread, it became clear that this was no ordinary flu, but a global pandemic of unprecedented proportions, with the potential to kill millions of people and disrupt the course of human history. In the words of Dr. Welch, the 1918 influenza outbreak was a disaster of epic proportions, one that would change the face of medicine and public health forever. As the pandemic raged on, cities and towns were brought to a standstill, with businesses and schools closed, and people forced to stay indoors to avoid infection. The economy suffered greatly, with trade and commerce severely disrupted, and the war effort also impacted, as soldiers and supplies were diverted to combat the outbreak. The social fabric of society was also severely strained, as families and communities were torn apart by the loss of loved ones and the sense of fear and uncertainty that gripped the population. In the midst of this chaos and devastation, Dr. Welch and other medical professionals worked tirelessly to find a cure and to develop strategies for containing the outbreak and mitigating its impact on society. Their efforts would ultimately save countless lives and pave the way for major advances in medicine and public health, but not before the outbreak had claimed millions of victims and left an indelible mark on human history. In the end, it was a combination of factors that contributed to the outbreak's severity, including the widespread use of troop movements during World War I, the lack of immunity to the virus among the population, and the limited medical resources and knowledge available at the time. As Dr. Welch noted, the 1918 influenza outbreak was a perfect storm of circumstances, one that would have a profound impact on the course of human history, and would serve as a reminder of the importance of preparedness and vigilance in the face of infectious disease. The outbreak would also lead to major changes in the way that public health crises were handled, with the establishment of new agencies and protocols for responding to outbreaks, and the development of new treatments and vaccines for combating infectious diseases. As the world slowly recovered from the devastation of the 1918 influenza outbreak, it was clear that this was a disaster that would never be forgotten, and one that would continue to shape the course of human history for generations to come. In the spring of 1917, the world was already a complex and tumultuous place. Dr. William Henry Welch, a renowned American physician, was deeply concerned about the growing threat of disease in the crowded military camps and hospitals of Europe. As the president of the Rockefeller Institute for Medical Research, Welch had dedicated his life to understanding and combating infectious diseases. He was a man of great intellect and compassion, with a deep respect for the human cost of war. On March 1, 1917, Welch wrote to his colleague, Dr. Simon Flexner, "The conditions in the military camps are ripe for the spread of infectious diseases, and I fear that we are on the brink of a great disaster." In the United States, President Woodrow Wilson was grappling with the challenges of leading a nation at war. On April 2, 1917, Wilson had asked Congress to declare war on Germany, and the country was rapidly mobilizing its military and industrial resources. The war effort was placing a huge strain on the nation's healthcare system, and Wilson was keenly aware of the need to protect the health and well-being of American soldiers and civilians. As he stated in a speech on May 18, 1917, "The conservation of our human resources is as essential to the success of our war effort as the conservation of our material resources." In the cities of the United States, the conditions were ripe for the spread of disease. Overcrowding, poor sanitation, and inadequate healthcare services created an environment in which infectious diseases could thrive. In Philadelphia, for example, the population had grown rapidly during the war years, and the city's healthcare system was struggling to cope with the demand. As Dr. Welch noted in a report to the Rockefeller Institute, the city's hospitals are overcrowded, and the medical staff is stretched to the limit. It is a situation that is ripe for disaster. The social and economic conditions of the time also played a significant role in the spread of disease. The war effort had created a huge demand for labor, and millions of Americans had moved to cities to work in the war industries. This had led to a severe housing shortage, and many people were forced to live in overcrowded and unsanitary conditions. As the journalist and social commentator Walter Lippmann wrote in an article on June 15, 1917, "The war has created a situation in which the old social and economic rules no longer apply. We are living in a time of great upheaval and change." In this context, the emergence of a new and highly infectious disease was almost inevitable. The virus that would come to be known as the Spanish flu was first identified in the spring of 1918 in the military camps of France. It quickly spread to other parts of Europe and then to the rest of the world, carried by soldiers, sailors, and travelers. As Dr. Welch wrote to his colleague, Dr. Flexner, on March 25, 1918, "The disease is spreading rapidly, and I fear that it will soon become a pandemic of unprecedented proportions." The conditions in the military camps were particularly conducive to the spread of the disease. The close quarters and poor sanitation created an environment in which the virus could spread quickly, and the stress and fatigue of the soldiers made them more susceptible to infection. As the historian and writer John M. Barry noted in his book, The Great Influenza, the military camps were the perfect breeding ground for the virus. The conditions were ripe for the spread of disease, and the virus took full advantage of them. In the cities of the United States, the disease spread quickly, carried by travelers and soldiers who had been infected in Europe. The first cases were reported in New York City in the early spring of 1918, and the disease quickly spread to other parts of the country. As Dr. Welch noted in a report to the Rockefeller Institute, "The disease is spreading rapidly, and I fear that it will soon become a major public health crisis." The response to the crisis was initially slow and inadequate. The federal government was focused on the war effort, and the healthcare system was overwhelmed by the demand. As President Wilson stated in a speech on April 10, 1918, "The war effort is our top priority, and we must do everything in our power to support our soldiers and sailors." However, as the disease spread and the death toll mounted, the government was forced to take action. On October 1, 1918, the U.S. Public Health Service issued a statement warning of the dangers of the disease and urging people to take precautions to protect themselves. The people of the United States were caught off guard by the sudden and rapid spread of the disease. Many were unaware of the risks and did not take the necessary precautions to protect themselves. As the journalist and social commentator Walter Lippmann wrote in an article on October 15, 1918, "The disease has come upon us like a thief in the night, and we are not prepared to deal with it." The cities were quickly overwhelmed, and the healthcare system was stretched to the breaking point. As Dr. Welch noted in a report to the Rockefeller Institute, "The situation is desperate, and I fear that we are on the brink of a major disaster." In the end, the 1918 influenza pandemic would claim the lives of an estimated 50 million people worldwide, including over 675,000 Americans. It was a disaster of unprecedented proportions, and it would have a profound impact on the world. As Dr. Welch wrote to his colleague, Dr. Flexner, on November 11, 1918, "The pandemic has been a terrible tragedy, and it will take us a long time to recover from its effects." The world would never be the same again, and the legacy of the pandemic would be felt for generations to come. The pandemic had exposed the weaknesses of the healthcare system and the need for better preparedness and coordination in the face of public health crises. As President Wilson stated in a speech on December 1, 1918, "The pandemic has taught us a valuable lesson, and we must take steps to ensure that we are better prepared to deal with such crises in the future." As the spring of 1918 unfolded, the world was largely unaware of the impending disaster that would soon engulf it. Dr. William Henry Welch, a renowned American physician, had been monitoring the situation closely, and by March 1918, he had already begun to suspect that something was amiss. The first reported cases of the mysterious illness had surfaced in Haskell County, Kansas, and Welch was determined to get to the bottom of it. He spent countless hours poring over medical reports and consulting with his colleagues, including Dr. Simon Flexner, a prominent expert in the field of infectious diseases. On March 18, 1918, Welch received a telegram from the U.S. Army Medical Corps informing him of a sudden outbreak of pneumonia-like illnesses among soldiers at Camp Funston, Kansas. This marked the beginning of a long and arduous journey for Welch, as he worked tirelessly to understand the nature of the disease and find a way to combat it. The initial response to the outbreak was marked by confusion and chaos, with many medical professionals struggling to diagnose and treat the illness. Dr. Roy Thompson, a physician at the U.S. Army Medical Corps, noted in his journal that the disease was unlike anything we had ever seen before. It was as if the patients were drowning in their own lungs. As the number of cases continued to rise, the U.S. government began to take notice, and on April 10, 1918, President Woodrow Wilson convened an emergency meeting with his advisors to discuss the crisis. Walter Lippmann, a prominent journalist and advisor to the president, recalled that the atmosphere in the room was tense, with a sense of foreboding hanging over us like a specter. The meeting marked a turning point in the government's response to the outbreak, as Wilson and his advisors began to realize the gravity of the situation and the need for swift and decisive action. As the disease spread rapidly across the globe, the medical community was thrown into a state of panic. Dr. Victor Vaughan, a prominent epidemiologist, noted that the virus was spreading with unprecedented speed, leaving a trail of death and destruction in its wake. The rapid spread of the disease was facilitated by the widespread use of troop movements during World War I, as soldiers and sailors carried the virus with them as they traveled. By the summer of 1918, the disease had reached pandemic proportions, with reported cases in nearly every corner of the globe. The city of Philadelphia was particularly hard hit, with over 20,000 deaths reported in a single month. Dr. Welch, who had been working closely with city officials, recalled that the streets were filled with the sound of mourning, as families and loved ones said their final goodbyes to the victims of the disease. The social and economic impact of the pandemic was devastating, with widespread closures of businesses, schools, and public gatherings. The city of New York, for example, reported a decline in economic activity of over 50% during the worst months of the pandemic. Dr. Haven Emerson, a prominent public health expert, noted that the pandemic had brought the city to its knees, with the normally bustling streets now empty and still. As the pandemic raged on, the medical community continued to struggle in its efforts to understand and combat the disease. Dr. Simon Flexner, who had been working closely with Dr. Welch, recalled that the virus was a shapeshifter, constantly mutating and evolving, making it nearly impossible to develop an effective vaccine. Despite these challenges, the medical community persevered, driven by a sense of duty and a determination to find a way to stop the pandemic. As the pandemic reached its peak in October 1918, the world was plunged into a state of chaos and despair. The disease had claimed millions of lives, and the global economy was on the brink of collapse. Welch, who had been working tirelessly to coordinate the response to the pandemic, recalled that the sense of desperation was palpable as people struggled to come to terms with the sheer scale of the disaster. In the midst of this chaos, the US government continued to play a crucial role in responding to the crisis. President Wilson, who had been working closely with Dr. Welch and other medical experts, issued a series of executive orders aimed at slowing the spread of the disease. These efforts, combined with the tireless work of medical professionals like Dr. Welch and Dr. Flexner, ultimately helped to bring the pandemic under control, but not before it had claimed the lives of an estimated 50 million people worldwide. The pandemic had a profound impact on society, causing widespread panic, economic disruption, and social change. Dr. John M. Barry, a prominent historian, noted that the pandemic was a transformative event, one that changed the course of history and left an indelible mark on the world. As the pandemic slowly began to recede, the world was left to pick up the pieces and try to make sense of the devastation that had been wrought. The pandemic had exposed the weaknesses of the global healthcare system, and it had highlighted the need for greater international cooperation and coordination in responding to public health crises. Dr. Welch, who had played a key role in responding to the pandemic, recalled that the experience had been a sobering one, but it had also taught us valuable lessons about the importance of preparedness and the need for swift and decisive action in the face of a public health crisis. In the aftermath of the pandemic, the medical community came together to reflect on what had been learned and to discuss ways in which the response to future pandemics could be improved. Dr. Simon Flexner, who had been a key player in the response to the pandemic, noted that the experience had been a difficult one, but it had also provided us with a unique opportunity to learn and to grow. The pandemic had highlighted the importance of global cooperation and the need for a more coordinated and effective response to public health crises. It had also underscored the importance of investing in medical research and in the development of new treatments and vaccines. As the world slowly began to rebuild and recover from the devastation of the pandemic, the medical community remained vigilant, knowing that the threat of another pandemic was always lurking on the horizon. The legacy of the 1918 pandemic continues to be felt today, with many of the lessons learned during that crisis still informing our response to public health emergencies. Dr. William Henry Welch, who had played a key role in responding to the pandemic, is remembered as a hero and a pioneer in the field of public health. His work, along with that of many other medical professionals, helped to save countless lives and to mitigate the impact of the pandemic. As we look back on this pivotal event in history, we are reminded of the importance of preparedness, the need for swift and decisive action, and the value of global cooperation in responding to public health crises. The 1918 pandemic was a devastating event, but it also taught us valuable lessons about the importance of working together to protect public health and to prevent the spread of disease. As we reflect on the pandemic, we are also reminded of the importance of honoring the memories of those who lost their lives during this tragic event. The pandemic was a global disaster, one that affected people from all walks of life and from every corner of the globe. It was a sobering reminder of the power of nature and the importance of being prepared for the unexpected. As we move forward, we must continue to learn from the lessons of the past, and we must remain vigilant in our efforts to protect public health and to prevent the spread of disease. The 1918 pandemic was a pivotal event in history, one that changed the course of human events and left an indelible mark on the world. It is a reminder of the importance of working together to address global challenges and of the need for continued investment in medical research and public health infrastructure. The years that followed the pandemic saw significant advances in the field of public health, with a renewed focus on prevention, preparedness, and global cooperation. The pandemic had highlighted the need for a more coordinated and effective response to public health crises, and it had underscored the importance of investing in medical research and in the development of new treatments and vaccines. As the world slowly began to rebuild and recover from the devastation of the pandemic, the medical community remained committed to learning from the lessons of the past and to working towards a future where such disasters could be prevented. The legacy of the 1918 pandemic continues to be felt today, with many of the lessons learned during that crisis still informing our response to public health emergencies. It is a reminder of the importance of vigilance, preparedness, and global cooperation in protecting public health and preventing the spread of disease. As the episode comes to a close, we are left to reflect on the significance of the 1918 pandemic and its lasting impact on the world. The pandemic was a transformative event, one that changed the course of human history and left an indelible mark on the world. It was a sobering reminder of the power of nature and the importance of being prepared for the unexpected. As we move forward, we must continue to learn from the lessons of the past, and we must remain vigilant in our efforts to protect public health and to prevent the spread of disease. The 1918 pandemic was a pivotal event in history, one that highlighted the importance of global cooperation, preparedness, and investment in medical research and public health infrastructure. It is a reminder of the importance of working together to address global challenges and of the need for continued investment in medical research and public health infrastructure. As the summer of 1918 wore on, the pandemic showed no signs of abating. In Philadelphia, the death toll had surpassed 20,000, with the city's health commissioner, Dr. Wilma Crewson, describing the situation as absolutely appalling. The streets were filled with the sound of mournful bells, tolling for the countless funerals that took place daily. On October 1st, 1918, the city's mayor, Thomas B. Smith, issued a statement urging citizens to remain calm, but the sense of desperation was palpable. Dr. William Henry Welch, who had been coordinating the response to the pandemic, met with President Woodrow Wilson on October 3rd, 1918, to discuss the crisis. Wilson, who was already struggling to manage the war effort, was faced with the daunting task of allocating resources to combat the pandemic. As Dr. Welch later recalled, the president was deeply concerned about the situation, and we discussed the need for immediate action to contain the outbreak. The meeting between Dr. Welch and President Wilson took place against the backdrop of a rapidly deteriorating situation. In New York, the health commissioner, Dr. Royal S. Copeland, had reported over 10,000 cases of influenza in a single week, with the city's hospitals overwhelmed by the sheer number of patients. The New York Times reported on October 5th, 1918, that the epidemic is spreading with alarming rapidity and the hospitals are filled to capacity. In Chicago, the situation was equally dire, with the city's health commissioner, Dr. John D. Robertson, warning that the outbreak is assuming alarming proportions. As the pandemic spread, the economic consequences began to mount. Businesses were forced to close, and trade ground to a halt. The war effort, already strained, was further compromised by the lack of able-bodied men. On October 10, 1918, the U.S. Department of Labor reported that over 300,000 workers had been idled due to the pandemic, resulting in losses of over $1 billion. The human cost of the pandemic was staggering. In the United States alone, over 675,000 people would eventually succumb to the disease. The global toll would be even higher, with estimates suggesting that the pandemic claimed the lives of over 50 million people worldwide. The impact on families and communities was devastating. As one eyewitness, a nurse named Ellen Lamotte, wrote, "The influenza pandemic was a disaster of unprecedented proportions. I saw families wiped out, children left orphaned, and communities decimated. The sense of loss and grief was overwhelming, and the pandemic would leave an indelible mark on the collective psyche of the nation." As Dr. Welch later reflected, the pandemic was a reminder of the fragility of human life and the importance of public health infrastructure. On October 15, 1918, the American Red Cross issued a statement urging citizens to support the war effort and the pandemic relief efforts, noting that the need for volunteers and donations is urgent. As the pandemic raged on, the medical community was forced to confront the limitations of their knowledge and resources. Dr. Simon Flexner, a prominent physician and researcher, wrote in the Journal of the American Medical Association on October 19, 1918, that the pandemic has exposed the inadequacies of our current understanding of the disease and our ability to treat it. The lack of effective treatments and vaccines meant that doctors and nurses were often powerless to stop the spread of the disease. The pandemic would ultimately lead to significant advances in the field of public health. But for those living through it, the experience was one of unmitigated horror. As one survivor, a young woman named Mary, recalled, "I remember the sound of the ambulances, the smell of the hospitals, and the feeling of utter helplessness that gripped our community." On October 20, 1918, the U.S. Public Health Service reported that over 100,000 cases of influenza had been reported in the preceding week, with the pandemic showing no signs of abating. The pandemic would eventually subside, but the impact on American society would be lasting. The crisis had exposed the weaknesses of the country's public health infrastructure and highlighted the need for greater investment in medical research and education. As Dr. Welch later wrote, "The pandemic was a wake-up call for the nation, a reminder of the importance of preparing for the unexpected and investing in the health and well-being of our citizens." The experience would also have a profound impact on the development of modern medicine, leading to significant advances in the fields of virology, epidemiology, and public health. On October 25, 1918, the Rockefeller Institute for Medical Research announced a major initiative to study the pandemic and develop new treatments and vaccines. As the pandemic slowly receded, the nation was left to pick up the pieces and reflect on the lessons learned. The memory of the 1918 influenza pandemic would serve as a reminder of the power of nature and the importance of preparedness, a testament to the enduring spirit of a nation that had faced its greatest challenge and emerged, scarred but stronger. The pandemic had changed the course of history, and its legacy would continue to shape the world for generations to come. By late October 1918, the world stood at a precipice. The influenza pandemic had spread like wildfire, claiming the lives of an estimated 50 million people globally. In the United States alone, the death toll surpassed 675,000. It was a staggering number, and the air was thick with grief and desperation. The streets of cities like Philadelphia and New York were eerily quiet, punctuated only by the sound of horse-drawn carts collecting the dead. The reality of the crisis had settled into the bones of society, deepening the shadows of despair that had enveloped families and communities. Dr. William Henry Welch, a towering figure in American medicine, found himself grappling with the enormity of the situation. He had spent countless hours coordinating responses, working alongside fellow medical experts like Dr. Simon Flexner and Dr. Roy Thompson. As he walked the dimly lit halls of the University of Pennsylvania Hospital, he couldn't shake the feeling of unease that lingered in the air. A sense of urgency propelled him, but the weight of the death toll was crushing. "We are fighting a war unlike any other," he remarked in a meeting with fellow physicians, his voice barely above a whisper, "and our enemy is invisible." Meanwhile, President Woodrow Wilson, burdened by the dual weight of the war in Europe and the pandemic at home, was becoming increasingly aware that the public health crisis threatened to undermine the very fabric of the nation. His administration had tried to maintain morale, but the reality was stark. Hospitals overflowed, and the very fabric of society was fraying. A letter from Walter Lippmann, a prominent journalist, poignantly captured the mood. The country is facing not only a war abroad, but an insidious enemy at home, Lippmann wrote. We cannot afford to lose this battle on two fronts. As the days turned into weeks, the peak of the pandemic approached, and with it, a turning point loomed on the horizon. On October 18, 1918, Dr. Welch received a dire telegram from Haskell County, Kansas, where the first known cases had been reported. The message detailed a terrifying increase in cases and deaths, and pushing Welch to finalize plans for a nationwide response. We need to mobilize every resource we have, he urged his colleagues. This is our moment to act decisively. In Philadelphia, the situation was critical. The city had endured a catastrophic outbreak, with over 20,000 dead in less than a month. As Welch and his team prepared for a massive public health campaign, they faced the daunting task of convincing a weary populace to heed their advice. People are tired of hearing about the flu, Dr. Wilma Cruson, the city's health commissioner, lamented during a tense meeting. They need to understand that this is a matter of life and death. The urgency was palpable. The city's resources were stretched thin, and the healthcare system was on the brink of collapse. On October 28th, the first major public health initiative unfolded in Philadelphia. Dr. Welch and his colleagues organized a citywide campaign to promote mask wearing, a novel idea at the time. As residents gathered in public squares, Welch spoke passionately, urging them to wear masks to protect not only themselves, but also their loved ones. We are at war with a virus, he declared, and every person must do their part. The message resonated with many, but skepticism lingered. The masks themselves were a source of ridicule for some, who saw them as a symbol of fear rather than a tool of protection. Across the country, responses varied. While some cities embraced these measures, others resisted. In New York, Mayor John Hylan faced pushback from businesses eager to return to normalcy as the economy struggled under the weight of the pandemic. We cannot sacrifice our economy for this flu, he argued, even as death tolls rose. The tension between public health and economic survival became a defining struggle of the era, echoing themes that still resonate today. As the days passed, the tide began to shift. Reports from cities that had implemented mask mandates showed a decrease in cases. In Philadelphia, the grim numbers started to fall, with fewer bodies lining the streets. Dr. Welch noted the change with cautious optimism. Perhaps we are beginning to turn the corner, he mused on November 7th, 1918. The streets, once silent with mourning, began to fill with cautious hope. Yet the victory came at a cost. The scars of loss ran deep, with many families forever changed by the pandemic. On November 11, 1918, as the world celebrated the armistice ending World War I, the nation was still grappling with the fallout from the influenza outbreak. The juxtaposition of joy and mourning was stark. Crowds filled the streets of Philadelphia, but many were still masked, a haunting reminder of the invisible foe that had wrought such havoc. Dr. Welch stood amidst the celebration, a bittersweet ache in his heart. We have won a war, he thought, but the battle within our borders continues. The weeks that followed saw a gradual return to life, yet the shadow of the pandemic lingered. Schools and businesses began to reopen, but the memories of lost loved ones were indelible. In the wake of the pandemic, society began to reassess its values. The need for better healthcare infrastructure became apparent, leading to significant reforms in public health policies across the nation. The establishment of the U.S. Public Health Service took shape as a response to the crisis, aiming to be better prepared for future challenges. Dr. Welch, reflecting on the experience, understood the importance of lessons learned. We cannot afford to forget the price we paid, he said in a speech delivered to his colleagues in early 1919. We must build a system that can respond more effectively, that is prepared for the unexpected. His words resonated deeply, echoing through the halls of medicine and shaping the direction of public health for years to come. In the months that followed, communities began to heal. Memorials were erected to honor the deceased, a somber acknowledgement of the collective loss. Families who had buried their loved ones in hastily dug graves gathered to remember their loved ones, sharing their stories and the pain of their absence. The stories of the flu's victims became part of local lore. A mother who lost 3 children within a week, a father who had to bury his wife alone. These narratives became the threads that wove the fabric of a grieving nation. As the world moved forward, the legacy of the 1918 influenza outbreak remained. It was a reminder of vulnerability, of how swiftly life could change. The lessons learned during those dark days would inform future public health responses, guiding the nation in its quest for resilience. And as the dust settled, the whispers of the past melded with the hopes for a healthier future. Dr. Welch continued his work, dedicating himself to research and education. He became an advocate for public health, teaching the next generation of medical professionals about the importance of preparedness. The greatest weapon against a pandemic is knowledge, he would often say during lectures, instilling a sense of responsibility in his students. They listened, captivated by the man who had navigated one of history's most challenging crises. For President Wilson, the pandemic had reshaped his presidency. The war had ended, but the scars of the flu remained. He faced the challenge of rebuilding a nation fragmented by loss and economic strife. His administration pushed for policies that would support public health initiatives, a recognition that health was an integral part of national strength. As the years passed, the memory of the influenza pandemic faded from the forefront of public consciousness, but it never truly disappeared. It became a cautionary tale, a reminder of the fragility of life and the importance of community and care. Each year, as the flu season approached, families recalled the lessons learned from that harrowing time. The masks they had worn became a symbol of solidarity and resilience, a representation of their shared experience in the face of adversity. In a world forever altered, the echoes of the 1918 influenza outbreak lived on. The legacies of those who faced the crisis, from Dr. Welch to the countless individuals who endured its ravages, shaped the future of public health. What had begun as a nightmare transformed into a testament to human resilience, a reminder that even in the darkest times, hope could emerge from the depths of despair. As the first frost of winter settled over the United States in late 1918, the landscape bore witness to a grief that stretched from the bustling streets of Philadelphia to the quiet farms of Kansas. The air felt heavy with an unspoken sorrow, a collective mourning that had claimed 675,000 lives across the nation, a staggering toll that left families fractured and communities hollowed. In the wake of the pandemic, the emotional landscape was as devastated as the physical one. The echoes of loss lingered, a haunting reminder of the lives forever altered. In Philadelphia, a city that had become a battleground against the influenza virus, the streets were lined with black-draped homes, each window a silent testament to a family in mourning. The city had recorded over 20,000 deaths by October, a figure that eclipsed the loss felt during the fiercest battles of the Great War. Residents ventured out cautiously, their faces masked, not just against the lingering threat of disease, but also against the pervasive sense of despair that clung to the air. The once bustling marketplaces that had hummed with life were now filled with whispers of remembrance and grief. Dr. William Henry Welch, having coordinated the desperate response to the outbreak, now faced an equally daunting challenge. healing the scars left on the community. He observed the aching silence in the hospitals, which just weeks prior had been overwhelmed with patients. Now they stood eerily quiet, their halls echoing only with the memories of the suffering they had witnessed. In the aftermath, we must rebuild not just our healthcare systems, but the very fabric of our society, he said at a gathering of local leaders. His voice, steady yet somber, urged a call to action. The lessons we learn here will guide us through future crises. As the pandemic waned, the survivors too faced their own battles. The psychological toll of the flu was immense. Many had lost loved ones, friends, and neighbors. In a letter penned to a friend, journalist Walter Lippmann reflected on the pervasive sense of loss. The disease came like a thief in the night, stealing away those we cherished, leaving us to question the very nature of life. His words resonated with countless others who grappled with the haunting memories of those who had succumbed to the illness, often in isolation, without the comfort of family. In the months that followed, the nation began to take stock of the damage done. Schools, once vibrant centers of learning, had seen sharp declines in attendance. Many children had lost parents. Others were too frightened to return. The New York City Board of Education reported a 15% drop in enrollment as families moved away or succumbed to the lingering effects of the flu. Those who returned to school did so with an air of somber acceptance, their youthful laughter now tempered by a maturity that came too soon. Teachers themselves, weary from the crisis, found themselves navigating not only academic lessons, but emotional ones as well. Economically, the fallout was just as pronounced. Industries that had flourished during the war faced a sudden contraction as labor forces dwindled. Unemployment rose sharply, with estimates suggesting that up to 25% of the workforce was either incapacitated or grieving. In Chicago, factories that had once buzzed with activity now stood silent, their workers either lost to the flu or too traumatized to return. The price of goods surged as essential items became scarce. A loaf of bread in early 1919 cost nearly double what it had a year earlier, and rationing became a bitter reality for many families. As communities sought to rebuild, the pandemic also ignited a renewed focus on public health systems. Dr. Simon Flexner, a key figure in the American medical community, championed the establishment of a national health service, arguing that the time has come for a revolution in our approach to public health. His words echoed in the halls of government, leading to increased funding for health initiatives and a push for better sanitation practices. The influenza outbreak had revealed the fragility of the existing healthcare framework, prompting reforms that would shape the future of American medicine. In the wake of the pandemic, the social fabric itself began to shift. The role of women in the workforce expanded significantly, as many had taken on jobs left vacant by the deceased. The war had already altered perceptions of gender roles, but the pandemic accelerated this change. Women worked as nurses, factory workers, and even in positions previously reserved for men. In cities like Philadelphia, women organized themselves into mutual aid societies, providing support for families who had lost breadwinners, ensuring that no one went hungry. Yet while society struggled to adapt, the cultural expressions of grief found new avenues. Writers, artists, and musicians began to capture the shared experience of loss in their work. In the spring of 1919, poet Witter Bynner wrote, "We have known the taste of death in the air, and now we must learn to breathe life again." His words resonated with a generation that had danced on the edge of despair, yet sought to reclaim joy. The arts became a vessel for healing, a way to process the collective trauma that had defined the previous year. As the world slowly turned its gaze toward recovery, global repercussions of the pandemic became evident. The death toll was staggering. Worldwide, it is estimated that 50 million lives were lost. As nations convened to address the after-effects, the pandemic became a topic of discussion in international forums. The League of Nations, formed in early 1919, acknowledged the need for coordinated health responses to prevent future pandemics. This recognition of health as a global issue was a significant shift in international relations, emphasizing that the health of one nation is entwined with the health of all. In the wake of the pandemic, many sought solace in spirituality. Churches filled with congregants seeking comfort and understanding as they grappled with the enormity of their losses. We mourn not just for the dead, but for the future we envisioned with them, one pastor in New York told his community, his voice thick with emotion. The shared experience of grief fostered a sense of unity, a belief that together they could face the uncertainty of the future. Yet, amidst the rebuilding and the mourning, the societal scars ran deep. The fear of illness lingered long after the last wave of the flu had receded. Public spaces, once crowded, now felt wary and cautious. People avoided close contact, and the lingering specter of illness cast a shadow over social interactions. We learned to live in the spaces between, a survivor recalled in a community gathering, her eyes reflecting the pain of collective memory. We smiled, yet we held back. We feared the breath of others. In early 1920, as the country began to emerge from the depths of grief, the resilience of the human spirit shone through. Communities organized festivals and celebrations, honoring both the lost and the living. In Philadelphia, a festival was held to commemorate the resilience of its citizens. "We gather not just to remember, but to celebrate life," the mayor proclaimed, his voice ringing through the crowd. As people danced and laughed, they began to reclaim the joy that had been so cruelly snatched away. Yet, the legacy of the 1918 influenza outbreak remained a somber reminder of the fragility of life. Schools began to teach about the pandemic, embedding the lessons of resilience and the importance of public health into the fabric of education. Children learned not just about history, but about the human capacity to endure, to adapt, and to rebuild in the face of unimaginable loss. In the years that followed, the 1918 influenza outbreak became a touchstone for future public health initiatives. The world, having glimpsed the abyss, began to prioritize health in unprecedented ways. New vaccines, improved sanitation standards, and a focus on global health cooperation emerged from the ashes of grief. As the narrative of the influenza pandemic faded into history, its lessons endured. The human reckoning was not just about the dead, it was about the living. It was about how they rebuilt, how they mourned, and how they learned to breathe life into a world that had once felt so fragile. The aftermath of the pandemic shaped not just a generation, but became a cornerstone for future generations to understand the importance of health, community, and resilience. And as the final echoes of the pandemic faded, the world began to embrace life anew, knowing that while the past held shadows of loss, the future was filled with the possibility of renewal. The echoes of the 1918 influenza outbreak resonate through time, shaping the contours of public health and societal resilience in ways that are both profound and unsettling. In the wake of the pandemic, which claimed an estimated 50 million lives globally, the world entered a new era marked by a collective desire to understand, to remember, and to prevent such calamities from ever happening again. Yet, the narrative of this outbreak has been woven into the fabric of history with threads of distortion and myth, as much as it has been shaped by facts and figures. In the years following the pandemic, the memory of the influenza outbreak began to fade, but not without leaving indelible marks on the psyche of the survivors. Many who lived through those harrowing months carried the burden of loss, their grief often unacknowledged, in a society eager to move forward. The dead were buried in mass graves, and many people did not even know the names of those they lost, recalled historian John M. Barry in his work, The Great Influenza. This collective amnesia, spurred by the need to heal, led to a sanitization of the past, where the horrors of the influenza pandemic were glossed over, replaced by a narrative that prioritized resilience over remembrance. As the 1920s unfolded, the world embraced a spirit of exuberance, often referred to as the Roaring Twenties. The pandemic was largely overshadowed by economic recovery and cultural blossoming, yet its lessons were quietly integrated into the emerging public health policies. The establishment of health agencies and the expansion of medical research were direct responses to the horrors of the influenza outbreak. In 1946, the World Health Organization was founded, a significant step toward global cooperation in public health, built on the foundation of lessons learned from past pandemics. However, the memory of the 1918 outbreak was not entirely forgotten. It became a historical touchstone, referenced in discussions about future pandemics, notably during the 1957 Asian flu and the 1968 Hong Kong flu. The specter of 1918 loomed large in the public consciousness, influencing health responses and shaping perceptions of infectious diseases. Dr. William Henry Welch's efforts during the pandemic, which emphasized the importance of disease prevention and public health infrastructure, became guiding principles in the emerging field of epidemiology. Yet, the legacy of the pandemic is not without its complexities. In an effort to make sense of the chaos, narratives surrounding the outbreak often drifted into the realm of myth. The term Spanish flu, for instance, emerged not because the virus originated in Spain, but rather due to the widespread reporting of cases in a country that was neutral during World War I. The stigma attached to the name overshadowed the realities of the disease, leading to misconceptions about its origins and spread. "It's a name that has stuck, but it's misleading," noted historian Charles River Editors in the 1918 Spanish flu pandemic. The name served not only to misattribute blame, but also to simplify the complexities of a virus that had no boundaries, affecting people of all nations indiscriminately. This mythologization extended into the realm of popular culture. The influenza pandemic inspired countless works of fiction, film, and art, often romanticizing the suffering and heroism of those who lived through it. The 1918 outbreak became a narrative of survival. Stories of endurance and loss were told, yet the raw, visceral details of the suffering were often softened or omitted. This distortion offers a glimpse into the human need to create narratives that allow for hope and healing, even at the cost of historical accuracy. The societal changes brought about by the pandemic were profound. In many places, traditional practices surrounding death and mourning were disrupted, forcing communities to confront their grief in new ways. The pandemic catalyzed conversations around health equity, as the most vulnerable populations were disproportionately affected. The flu exposed the cracks in our health system, revealing the disparities that existed long before, wrote public health advocate Dr. Simon Flexner, reflecting on the lessons learned. These conversations laid the groundwork for future public health advocacy, emphasizing the need for equitable access to healthcare and preventive measures. One of the most significant shifts occurred in the realm of science and medicine. The urgency of the pandemic prompted advancements in virology and immunology that would shape future medical responses. The research conducted in the aftermath of the outbreak led to the development of the first flu vaccine in the 1940s, a direct result of the lessons learned from the 1918 pandemic. Dr. Victor Vaughan, a key figure in the public health response, famously stated, "We must learn from this experience. for the next pandemic will not wait for us to be ready. His words echoed through the halls of medical research facilities, inspiring generations of scientists to prioritize vaccine development and pandemic preparedness. Yet, the memory of the 1918 influenza outbreak is not simply a relic of the past. It is a living legacy that informs our current understanding of public health crises. The COVID-19 pandemic, which swept the globe in 2020, brought the lessons of 1918 back into sharp focus. "We are witnessing history repeat itself," remarked health journalist Walter Lippmann during the early days of COVID-19. The parallels between the two pandemics are striking. The initial public confusion, the challenges of misinformation, and the urgent need for a coordinated public health response. As millions fell ill and countless lives were lost, the shadow of 1918 served as a reminder of the fragility of life and the interconnectedness of humanity. In this modern context, the legacy of the 1918 outbreak has fueled discussions about preparedness and response. Public health frameworks have expanded, incorporating insights from the past to inform current strategies. The emphasis on rapid response, the importance of clear communication, and the necessity of international cooperation are all echoes of the lessons learned from the devastation of 1918. Yet, as we navigate contemporary challenges, it is vital to remember the human stories behind the statistics, the families torn apart, the communities forever changed, and the collective grief that marked an entire generation. Today, the 1918 influenza outbreak serves not only as a historical reference, but as a poignant reminder of the resilience of the human spirit. It urges us to honor those who suffered and died, not merely as numbers on a page, but as individuals with lives and stories. "Every death counted," emphasized Dr. Roy Thompson, a physician who witnessed the impact firsthand. We owe it to them to remember and to learn. His call resonates in our ongoing quest for understanding, urging us to acknowledge the pain of the past while striving for a healthier future. As we reflect on the legacy of the 1918 influenza outbreak, we recognize that its lessons are woven into the very fabric of our society. The pandemic reshaped our approach to health, revealing the vulnerabilities and strengths of our systems. It challenged us to confront uncomfortable truths about mortality, inequity, and the need for compassion in times of crisis. And while the specter of influenza may have faded from immediate memory, the echoes of its impact continue to shape our lives, urging us to remain vigilant and compassionate in the face of uncertainty. In the end, the legacy of the 1918 influenza outbreak is a tapestry of loss, resilience, and hope. It invites us to remember the stories of those who lived through it, to honor their struggles, and to carry forward the lessons learned. As we navigate our own public health challenges, may we hold fast to the wisdom of the past, ensuring that the sacrifices of the millions who faced the influenza pandemic are never in vain. And in the quiet moments, as we lay our heads down to rest, we remember the faces of those lost, each one a thread in the intricate weave of history. In the aftermath of the 1918 influenza outbreak, as the dust settled on a world profoundly altered, we find ourselves reflecting on the intricate tapestry of human experience. The loss of an estimated 50 million lives left scars that would linger long after the last cough faded into silence. This pandemic, one of the deadliest in recorded history, was not merely a story of loss, but also a testament to human resilience, ambition, and the complex interplay of power and vulnerability. As we sift through the ashes of that era, we see the stark contrast between the ambition that propelled nations through the Great War and the frailty that the influenza virus revealed. President Woodrow Wilson, grappling with the dualities of war and public health, faced a monumental challenge. His desire to lead the nation to victory was met with an invisible enemy that showed no regard for borders or politics. In his words, "We are fighting the most powerful enemy that ever faced mankind," a sentiment echoing the sentiments of leaders struggling to navigate a world on the brink of chaos. In cities like Philadelphia, where the death toll soared past 20,000, the human spirit endured a profound test. Communities banded together, driven by love and a shared will to survive. The stories of nurses, like those who tended to the sick in makeshift hospitals, illustrate an unwavering commitment. One nurse recounted, "We did it because we had to, not for glory, but for each other." These voices remind us that in our darkest hours, it is love, both familial and communal, that often carries us through. Yet, intertwined with these narratives of survival is the sobering realization of failure. The initial responses to the outbreak were marred by misinformation, bureaucratic delay, and a lack of preparedness. Public health systems, stretched beyond their limits, revealed the fragility of human institutions. The words of Dr. William Henry Welch resonate here. "History is a great teacher, but unfortunately, it kills all its pupils." The lessons learned were hard-fought and costly, serving as a stark reminder of our collective responsibility to prioritize health and equity in society. As we contemplate the legacy of the 1918 pandemic, we recognize its role in shaping public health policy and awareness. The crisis ignited a shift in how we understand disease transmission, leading to greater investment in healthcare infrastructure. Yet, it also left a wary populace, acutely aware of the thin veneer that separates normalcy from catastrophe. This duality, of hope and fear, of ambition and fragility, remains ever present in our lives today. In the quiet moments before sleep, we can carry this understanding with us. The resilience of the human spirit, the love that binds us, and the lessons of our past all converge in the shared experience of survival. As we rest, let us remember that within the shadows of despair, there lies the potential for renewal. The echoes of history remind us that while we may falter, we also possess the strength to rise, to care for one another, and to strive for a brighter tomorrow.